a warm welcome. Today, our conversation will be about how our breathing, especially at night, can tell us important things about our health and how to pay attention to it in time. Have you ever woken up in the morning feeling as if you haven't slept at all? Or perhaps your spouse complains about how you breathe in your sleep. You know, our body is an amazingly wise system, and breathing during sleep is like a quiet, sometimes barely audible conversation it has with us about its state. When something in the body goes wrong, this conversation can change. At night, we have less control over ourselves. We relax, and it's precisely then that hidden problems can make themselves known through our breathing. It might become louder, more interrupted, heavier, or conversely, almost imperceptible. Imagine your airways are like a clear, free-flowing river, and some of our habits, say a very heavy dinner right before bed, or an extra glass of wine to help sleep, or even just sleeping on your back if you have a predisposition, are like someone throwing rocks and branches into this river, creating blockages and obstructing the flow. Breathing becomes harder, right? But what if I told you that by learning to recognize just 5 simple signals in your breathing, especially at night, you could spot those very warning signs that might indicate serious problems, such as heart issues, sleep apnea, or chronic lung diseases? Knowing these signals isn't a reason to panic, but rather your chance to find peace of mind and the opportunity to act consciously, to take care of yourself. And you don't need complex devices or tests for this, just your attention to your own body and a little knowledge. Let's listen together for these signals. I promise, everything will be clear, accessible, and, I'm sure, very beneficial for your health and well-being. Stay with me until the end, and you'll learn how your nighttime breathing can become your faithful ally in maintaining health. The first signal to pay attention to is loud, intermittent snoring, especially if accompanied by pauses in breathing. You know, many people are used to considering snoring just an annoying nuisance for their loved ones, a sort of male and sometimes female peculiarity. But it's not always so harmless. Let me tell you the story of George. George was 72 years old, a sturdy man who had worked his whole life as an engineer, used to fixing things and solving problems logically. But he couldn't do anything about his own snoring. His wife, Mary, had been complaining for years that his snoring sounded like a tractor, and worst of all, he would sometimes fall silent for several seconds, and then gasp so loudly it seemed like he was choking. George would brush it off. "So I snore. All the men in our family snored. What's the big deal?" Of course, he didn't feel well himself. He woke up exhausted, constantly wanted to nap during the day, became irritable, and his blood pressure started acting up. But he attributed it to age. Mary, however, grew increasingly worried. One day, she decided to record his nightly serenades on her phone's voice recorder. In the morning, she played it for George. At first, he laughed, but then he heard those frightening pauses, that desperate gasping after them, and he felt uneasy. It was as if he heard not just snoring, but an SOS signal from his own body. Imagine an engine sputtering, about to stall, and then roaring back to life trying to restart. That's what it sounded like. Or like a fish out of water, gasping convulsively for air. This sound finally prompted George to see a doctor. The diagnosis sounded unfamiliar, but explained everything: obstructive sleep apnea. His airways were periodically completely blocked during sleep. His brain suffered from oxygen deprivation, hence the awakenings, often unconscious, the daytime exhaustion, and the strain on his heart. He was offered treatment using a special sleep device, CPAP therapy. It's a mask that delivers air under slight pressure and prevents the airways from collapsing. George, of course, initially resisted. Sleep in a mask? Like an astronaut. Uncomfortable, unfamiliar. The first few nights were indeed difficult to get used to, but after just a week, he felt the difference. He started sleeping well. He woke up refreshed in the morning, his daytime energy returned, his mood improved, even his blood pressure stabilized. Mary could finally sleep peacefully beside him too. Physiologically, it was simple. The device acted like a gentle, constant breeze that softly kept the river of his airways open all night. Psychologically, the constant feeling of fatigue and anxiety about his health disappeared. The benefits are obvious: improved sleep quality, increased energy, reduced risk of hypertension, heart attack, stroke. So, if you or your loved ones notice very loud, intermittent snoring with pauses, don't brush it off. Listen closely. It's not just a sound. It could be your body's cry for help, which is important to hear in time. The second important signal is shortness of breath, or a feeling of air hunger when you lie down. Perhaps you've noticed that you're more comfortable sleeping on high pillows, almost sitting up, or that when you lie on your back, after some time, you start feeling like you can't get enough air and you have to sit up to catch your breath. This condition is called orthopnea, and it also deserves close attention. I want to share the story of Eleanor. She was 68 years old. She was a charming woman, loved her garden and grandchildren, but for the past couple of years, sleep had become a problem for her. She found herself piling up more and more pillows under her head, first 2, then 3, and eventually, she started falling asleep in an armchair because in bed, even with a mountain of pillows, it was hard for her to breathe. She felt a kind of pressure in her chest, as if she couldn't get enough air as soon as she lay down horizontally. Eleanor attributed it to the extra weight she had gained slightly after retiring and to her age. Getting old, so breathing is harder, she told her friends. But anxiety grew inside her, especially before bedtime. She started to fear going to sleep. One day, her daughter, visiting, noticed her pyramid of pillows and her troubled breathing in the evening. She persuaded Eleanor to see a cardiologist. The examination revealed an early stage of heart failure. Eleanor's heart wasn't working as efficiently as before, and when she lay down, blood would pool in the vessels of her lungs, causing the sensation of air hunger. Imagine your lungs are like 2 large balloons, and your heart is the pump that circulates blood throughout the body. When the pump weakens, fluid can accumulate in front of it, meaning in the lungs, especially when you lie flat. It's as if water starts flooding these balloons from below. The high pillows helped her keep the balloons higher above the level of this water. The doctor prescribed Eleanor treatment, small doses of medication to support her heart and remove excess fluid, recommended dietary adjustments, less salt, and added light walks. At first, Eleanor found it hard to believe the problem was her heart, as it had never bothered her before. But she started taking the medication and following the advice. And within a couple of weeks, she noticed that breathing while lying down became easier. Gradually, she was able to remove one pillow, then the second. Normal sleep in bed returned, and the anxiety before nighttime disappeared. She felt not only physically better, but also mentally calmer. The benefit of recognizing this signal is enormous. It allows for early diagnosis of serious heart problems, the opportunity to start treatment promptly and prevent complications, and improvement in the quality of sleep and life overall. Therefore, if you notice that you're more comfortable sleeping, almost sitting up, if lying flat causes shortness of breath, don't dismiss it as just an age-related quirk. It's an important signal that requires consultation with a doctor. The third signal, which can be very frightening, is sudden awakening in the middle of the night with a strong feeling of suffocation. The person wakes up in a panic, feels like they are choking, their heart is pounding wildly, they sit up in bed, gasping desperately for air. After a few minutes, breathing returns to normal, but the fear lingers. This condition is called paroxysmal nocturnal dyspnea, PND. Let's talk about David. He was 75 years old, a retired history professor, a very erudite and calm man. But several times over the past year, something inexplicable and terrifying happened to him. He would wake up in the middle of the night, feeling as if a heavy stone had been placed on his chest. He was desperately short of air, and his heart was leaping out of his chest. He would jump up, run to the window, throw it wide open, breathing in the cold night air. The attack would last a couple of minutes, then subside. But afterward, he couldn't fall back asleep for a long time, tossing and turning, listening to his every breath. David thought they were just very realistic nightmares or panic attacks due to stress. He was worried about an old friend's illness at the time. He even became a little afraid of falling deeply asleep, fearing a recurrence. He didn't tell anyone about it, feeling embarrassed, considering it a sign of weakness. But when these awakenings started happening more frequently, every couple of weeks, he finally decided to share it with his daughter, who worked as a nurse. She immediately realized it wasn't just nightmares and insisted he visit a cardiologist. The doctor, after listening to David, immediately suspected a connection to his heart. An examination confirmed the presence of heart failure, which manifested in exactly this way. The mechanism is similar to that of orthopnea, the second signal, But here, the fluid accumulates more slowly in the lungs during sleep, and when it reaches a critical level, the brain sounds the alarm, causing abrupt awakening and shortness of breath. It's like slowly rising water, suddenly spilling over the edge. The body triggers an emergency alarm. Imagine being suddenly pulled from deep sleep straight into a cold shower. The sensations are roughly the same: shock, panic, struggle for air. Incidentally, sometimes such attacks can also be related to very severe acid reflux, when stomach contents enter the airways during sleep. In David's case, it was his heart. He was prescribed appropriate treatment, and the attack stopped. David could sleep peacefully again, without fear of waking up suffocating. Not only the physical discomfort disappeared, but also the constant underlying fear. The benefit of recognizing this signal is the possibility of identifying serious heart or gastrointestinal diseases at an early stage, receiving adequate treatment, getting rid of frightening attacks, and regaining calm, restorative sleep. So, if you or someone close to you experiences such sudden nocturnal awakenings with suffocation, don't attribute it to nerves or nightmares. This is a very serious alarm signal from your body. Do not ignore it. Be sure to consult a doctor. The fourth signal is wheezing breath, or quiet rattles, chalk wheezes, during sleep. Perhaps you don't hear it yourself, but your partner might notice that during sleep, especially on exhalation, you produce a slight whistling or wheezing sound. Sometimes, this can be accompanied by coughing. People often attribute this to a cold, allergies, or simply dry air in the room. But if it happens regularly, even when you are healthy, it's also a reason to be cautious. Meet Margaret. She was 70 years old, an active pensioner, walked a lot, did yoga for seniors. But her husband, Bill, started noticing that at night, she sometimes quietly wheezed in her sleep. Not snoring, but specifically making this thin whistling sound on exhale. Sometimes she coughed a little in her sleep. Margaret herself felt that sometimes it was harder for her to exhale fully, especially after a brisk walk or if there was pollen in the air. But she thought it was age-related or a mild allergy. She had never smoked in her life and considered her lungs healthy. Bill mentioned this nighttime wheezing to her several times, but she brushed it off. "You imagined it. That's just how I breathe." But Bill was persistent. He was worried. He compared the sound to an old, slightly out-of-tune musical instrument making impure notes. He persuaded Margaret to see a pulmonologist. The doctor performed spirometry, a test that measures lung function. It turned out that Margaret had a mild form of bronchial asthma, or COPD, chronic obstructive pulmonary disease, which had barely manifested before but became more noticeable with age, especially during sleep when the airways naturally narrow slightly. Inflammation and mucus in the bronchi narrowed the passage, and the air passing through these narrowed tubes created a whistling sound, like blowing into a narrow bottleneck. The doctor explained that it wasn't dangerous if controlled. He prescribed Margaret an inhaler with a small dose of medication to use before bed or when symptoms appeared. Margaret was initially skeptical. Asthma? Me? At 70? But she decided to try it, and after just a few days, Bill said the nighttime wheezing was gone. Margaret herself noticed that it became easier to breathe, not only at night, but also during her daytime walks. The feeling of chest tightness disappeared. The inhaler seemed to widen those narrowed tubes in her lungs, allowing air to pass freely and quietly. The benefit here is to promptly identify and start controlling chronic lung diseases like asthma or COPD. This helps prevent their exacerbation, improve breathing and sleep quality, and ensure sufficient oxygen supply to the body. So, if you or your loved ones hear wheezing or rattles during nighttime breathing, even quiet ones, don't ignore them. This isn't just a breathing peculiarity. It could be a sign that your airways need support. Talk to your doctor about it. The fifth signal, which often goes unnoticed, is very rapid or, conversely, very shallow breathing during sleep. A person might breathe quietly, without snoring or wheezing, but either too frequently, as if they've just run a marathon, or so shallowly and lightly that it seems they are barely breathing at all. The sleeper themselves, of course, is unaware of this, but may feel the consequences. Constant fatigue, the feeling that sleep wasn't enough, no matter how long they slept. Let me tell you about Arthur. He was 78 years old, a very calm, intelligent man who loved reading and solving crosswords. But for the past few months, he complained of constant daytime sleepiness, and the feeling that he wasn't getting enough rest, even though he slept 8 to 9 hours. His wife, Claire, started listening to his breathing at night. There was no snoring, but she noticed something strange. Sometimes Arthur would start breathing very rapidly and shallowly, almost like a frightened rabbit, and then his breathing would become very slow and barely noticeable. She told Arthur about it, but he just shrugged. "Well, I breathe. What's the big deal?" However, Claire insisted on a visit to the general practitioner. The doctor listened carefully to both of them. He explained that such altered breathing patterns during sleep, tachypnea, too rapid, hypopnea, too shallow, could be a sign of various conditions. It could be related to anxiety, lung problems, heart failure, or sometimes even be a side effect of certain medications. Such breathing is inefficient. Breathing too rapidly and shallowly doesn't allow the lungs to ventilate properly and saturate the blood with oxygen, and breathing too slowly is even less effective. Imagine the ocean. Its breathing is deep, rhythmic, powerful. Arthur's breathing during sleep was sometimes like small ripples on water during a storm, and sometimes like an almost complete calm when the water barely stirs. Neither reflects a healthy, calm rhythm. The doctor ordered additional tests for Arthur to determine the cause. It turned out he had a combination of factors: slightly increased anxiety and early signs of lung problems. His therapy was adjusted, breathing exercises and relaxation techniques before bed were added. Gradually, his sleep became deeper and more regular. He stopped feeling exhausted in the mornings, his mental clarity returned, and he had energy for his beloved crosswords. The benefit of paying attention to this signal is that it can point to hidden problems requiring diagnosis and treatment, whether it's an anxiety disorder, lung or heart disease, or the need to review current medications. Normalizing breathing during sleep improves blood oxygen saturation, sleep quality, and overall well-being. Therefore, even if your nighttime breathing is quiet, pay attention to its rhythm and depth if possible, e.g., by asking loved ones. The feeling of being unrested despite long sleep might start right here, in subtle changes in your breathing pattern. And so, we have looked at 5 important signals. What should you do if you notice any of these in yourself or a loved one? I understand that hearing all this might make you a little scared, or conversely think, "Oh, I have a bit of all of these. Maybe it's just age," or "I don't want to go to the doctor, they'll find a bunch of things again." These feelings are completely natural, but I want to urge you to treat this information not as a reason for fear, but as an opportunity to show wise care for yourself. The first step is observation. If possible, ask your spouse or someone in your household to listen to your breathing at night. Or, if you sleep alone, try recording the sounds during sleep on your phone's voice recorder. Sometimes, this can provide useful information. You could keep a small sleep diary. Note how you slept, how you felt in the morning, whether there were any peculiarities in your breathing that you noticed, e.g., shortness of breath when falling asleep. Your own observations and feelings are invaluable information for the doctor. The second and most important step: do not self-diagnose or self-treat. Please do not diagnose yourself based on internet searches or ignore symptoms hoping they will go away on their own. These 5 signals we talked about are not diagnoses. They are just clues, flags that your body raises to get your attention. Only a qualified doctor can figure out the true causes and choose the right solution after an examination. Your visit to the doctor is not an admission of weakness or infirmity. On the contrary, it is a manifestation of strength, responsibility, and self-love. It's like if you noticed a strange noise in your car. You wouldn't wait until it breaks down in the middle of the road, would you? You'd go to a service center to find out the cause and fix it. It's the same with our body. Hearing its signals in time means getting a chance to prevent serious problems, improve your quality of life, and extend its active, joyful years. Remember, knowledge is power. In our case, knowing these signals gives you the power to act, the power to take care of yourself and maintain your health and peace of mind. Your health is truly largely in your hands, and your breathing is a sensitive compass that can point you in the right direction. So, these seemingly subtle details of our nighttime breathing can tell us a great deal about our well-being. Today, we listened to 5 important signals that should not be ignored. You have lived a long, eventful life, accumulated invaluable life experience, wisdom that you can share with children and grandchildren. Your body, your faithful companion on this journey, has also accumulated its own history, its joys, and its difficulties. And it, like no other, deserves your most careful, attentive, and kind treatment. Please remember that taking care of yourself, your health, and comfort is not selfishness. It is your inalienable right. The right to calm, restorative sleep, to a cheerful morning without fatigue, to a clear head and good mood, to the ability to enjoy each new day, at any age. Don't be afraid to listen to yourself. Trust your feelings, your intuition. And know this, even the smallest steps you take today for your health, for a better understanding of your body, are a huge contribution to your future well-being, to the fullness and joy of your life. Believe in yourself, in your strengths. You will definitely succeed. Be healthy and breathe easily.